ahead, Hannah.
Thank you so much. So the next committee meeting this morning is Public Health, Safety, and Justice, which is chaired by Councilmember Hamill. So I would turn it over to him.
Good morning, everyone. I'm joined on the committee this morning by Council Members Knutson and Huffman. We have 3 items before us this morning. The first is an interlocal agreement for the 2021 paramedic class. Whatcom County and the city are continuing to work together to provide an initial paramedic training program in support of our shared county-wide paramedic needs. The fire department serves as the lead in this training program, and this interlocal spells out the parameters and funding for the 2021 cohort. And here to take us through is Division Chief Scott Rickman.
Good morning, everyone. How are you this morning? Thanks for having me to talk through this this bill before you. So, yeah, as Councilman Hamill said, we've been doing EMS training, specifically paramedic training in the county since 1974, when Dr. Wayne was doing it out of his living room. We've come a long way since then. You know, we're hosted by the tech school at this point, so Bellingham Technical College. So when our paramedics are coming out of school at this point, they've got an AA and a legitimate training program that they're going through before they go out to serve the citizens on the street. So in front of us right now is just there's I think it was $579,000 and a little bit after that for funding that needs to be reimbursed back to the city for the costs associated with the program, including backfill for the students as they're on the floor, and then other class associated costs. So this has been a recurring theme or recurring contract we've done over the last several years. So this is an update to the contract from last year's class, cleaned up some language, and it's here for you today for your approval so we can start billing for the services we're providing to the county for education.
Thank you, Chief. Committee.
I'll move approval. How long is this for, Scott? Just 1 year, the budget cycle?
It's for this year. So our class started, the anatomy and physiology started in January. The actual classroom work associated with the more formalized training for street medicine part of it started here in March. And so it's about a 10-month program. We will have these folks on the road hopefully before the end of this year. We try to get them through the evaluation process before the holidays and things like that. But that might drag out a little bit longer this year. Just we got a little bit later start than we'd like on the actual class date. So
how many do you have in the class?
We've got 4 internal candidates right now from Bellingham Fire.
I think you froze there, Chief.
Yeah. Okay.
Government equipment, apparently.
Well, I'll jump in here, Bill Hugh, Fire Chief, while Scott's frozen. We have two BFD candidates that are in it, and then 2 from North Whatcom that will eventually transition into BFD as part of our shared program that we have with North Whatcom. So in total, there'll be 4 candidates in this class that'll be hitting the streets here in Bellingham at the end of the class.
Thank you, sir.
Councilmember Anderson.
Thank you for recognizing me. I support this agreement, but I just have a question, and it might be semantics. I noticed that Camino Island is also included as far as participating with this paramedic class. And on the interlocal agreement, page 261, at the top paragraph, it refers Whatcom County. And then further down, it just says county will provide. And I'm wondering, is there a different interlocal agreement with Camino Island that was not included? Or should it be the interlocal agreement state Island and Whatcom, and then change it to counties? Because when I read through this, it looks like the agreement is just with Whatcom County, but realizing that there's another county involved with this class, I'm just wondering where in this is their agreement with them that they're paying for, I think it's $25,900 for potentially 2 employees.
So yeah, that's a good catch on that. The program itself, our contract is with Whatcom County, and those funds are coming through the Whatcom County EMS fund. All of our interactions are as far as the funding movement, and that is all between us and Whatcom County. Separately, Whatcom County, in this case, this particular class, we had a couple of extra seats available. Whatcom County has allowed Island County to put 2 of their paramedics into this class, and Island County is paying Whatcom County for those services. So as far as our contract goes, it's just a straight agreement between us and Whatcom County. Whatcom County has a separate agreement that is charging for those 2 Camino students that'll reimburse the countywide EMS fund for those costs.
Okay, further questions from committee or council members? Okay, seeing none, all those in favor signify by saying aye.
Aye.
Opposed, abstentions? Seeing none, I'll go ahead and make that recommendation to the full council this evening. Our next item this morning is an ordinance amending, thank you, Chief Rickman and Chief Hewitt. Our next item is an ordinance amending the 2021-2022 biennial budget, increasing revenues and expenditures for paramedic training classes. The attached ordinance adds revenue and expenditure authority to fund the city's paramedic training program as described in the interlocal agreement with Whatcom County, also before the council today. The 2021-2022 biennial budget included the lead instructor for the program, but did not identify the revenue or other expenses associated with the program since program funding was still under negotiation. Because the budget already includes the staff member for both years, and because the fire department expects the program to continue into 2022, the attached ordinance adds revenue and expenditures for both 2021 and 2022. Revenues exceeding expenditures will reimburse the city for the previously budgeted staff member. And here to take us through is Forrest Longman.
Yeah, hi, Forrest Longman, Deputy Finance Director. So I'm just going to touch on a few items on this ordinance. Most of it was in the agenda bill there, but it's just important to note that while that contract that was, or the ILA that council just adopted was for 1 year, we are adopting the budget for 2 years. We fully expect this program to continue on, and we have a staff member that's dedicated to it, and we want to make sure we're recognizing the revenue for that for both years to help keep our budgets in balance. The other thing to note is this impacts 2 funds. In the general fund, $428,000 revenue and expenditures to pay for the backfill of positions when positions go into paramedic training, and then new trainees are hired to fill those positions. This covers that while the paramedics are in training. And then on the Medic One side, we have all the operational expenses, and the revenue on that side exceeds the expenditures because, again, we are paying for that training captain who was included in the biennial budget. So I'm happy to answer any questions about that, although I may have to defer to the chief on some of them.
Committee, questions?
I'll move approval.
Okay. Council members, any other questions, comments? Okay, seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Abstentions? Okay, I'll go ahead and make that recommendation tonight. And the third item before us this morning is the fire department strategic plan. In 2019, the fire department worked with a consultant to create a strategic plan that was finalized in 2020. Staff from the fire department will present an overview of the planning processes, identified goals, and an update on accomplishments related to the plan. And here to take us through is Fire Chief Bill Hewitt.
All right, again, good morning, Council. Bill Hewitt with the Fire Department. And today, yeah, this is culmination of several years in the making here. We, going back to the believe it was 2018, where council gave some direction to the fire department that they wanted to see a strategic plan to help organize some of the initiatives that we had been talking about at the council and budget level. We went through a process, about a year-long process, where we brought in a consultant and they looked at all aspects of the fire department and came forward with this strategic plan. The plan, as the agenda bill says, was actually ready to go here about a year ago, or a little over a year ago, when COVID hit. And at the time, we had received direction for initially there to only bring things needed for the continuation of business before council. So we kind of put this on hold for a little while, and then of course we got into budget process, and so here we are about a year later, ready to present the plan. Today I'm going to share my screen here, and okay, hopefully that's working there. We'll go over the different parts of the plan. Start with the process. So Matrix Consulting Group was the contractor that was chosen to help us work through this. That group came in, they did internal interviews with members of the organization, group discussions with the different work groups within the fire department, did some citizen input, working through the Mayor's Neighborhood Advisory Commission, and then did a lot of data collecting, looking through history of staffing, scheduling, response times, and call loads. As they went through this, they came up with 10 goals basically for our plan here into the future. And I'm going to walk through real quick the 10 goals, and then we'll go through a little more in depth on each goal in particular. But first one was to stabilize the staffing of the fire department. Next was to continue recruitment efforts to maintain an active hiring list and prepare for the number of retirements that we had coming. Third was to continue to promote a culture that values diversity within the organization. Fourth one was to improve our EMS response and support system. Fifth is to continue the improvements of the emergency services response plan. Next was to improve the capability of our life safety division, partner with other agencies to enhance training, improve health and wellness programs for emergency services employees, enrich the capabilities of our communications center, and finally enhance the capabilities of our emergency management function of the city. So these are the 10 overarching goals that are in the plan. As we kind of, again, take a little deeper dive in there, the first goal, stabilize the staffing. They had 3 key recommendations in there, which one was to increase the staffing to meet the contract requirements. That is, originally when I was putting this slideshow together, we wanted to show you the goals and then show you what we've already done. And originally I wanted to put in there that, we had completed that, and we have completed the budget portion of that. So back in the beginning of 2020, in the mid-biennium adjustments between 2019 and 2020, the council authorized 7 additional FTEs to help with staffing. And unfortunately, it's taking about 18 months for us to actually see the full outcome of that addition. So we, due to a number of losses through attrition, retirements, and resignations, and that we have yet to see what that full increase looks like. We have an academy of 11 folks that are still going through training, and we hope to see that fully completed here in June when that class graduates. Next recommendation was to increase the recruiting efforts for volunteer staffing. Again, in that mid-biennium between 19 and 20, we added a volunteer coordinator, and that captain has been working very hard to increase our volunteer staffing. We're still still having some struggles in that arena, as are all departments here in Whatcom County, but we have seen small incremental gains in the number of shift-ready volunteers that we have just in the last year, if we compared the year before to now. Third recommendation was to improve the retention of volunteer staff. Again, this is a program that's still ongoing, and our new volunteer coordinator, or now our volunteer coordinator, has been working on this for the last year. He's been working on not only those recruitment efforts, but he's also been looking at new programs and other things that are going on in the industry that we can use to help to ensure retention of some of those volunteers. The next goal was to continue recruitment efforts to maintain an active hiring list in preparation of a significant number of retirements. Again, as we go into this year, we're getting ready to, actually just this month, here at the end of the month, we're getting ready to celebrate the retirement of Battalion Chief Andy Day, who's held several different roles in the organization over 30 plus years here with the department. But he's just one example of, I think we're looking at a minimum of 6 retirements going on this year. We had several last year. And so with that, the consultants wanted to make sure that we were actively preparing for these transitions as they happen. As part of that, for the first time this biennium, we actually budgeted funds to have a hiring process and a recruit academy each year in 21-22. Previously, we had not budgeted for those processes and the academies as part of the overall budget process. It was usually one where we would come to the council as needs occurred. And in this case, based on the recommendations there, we've prepared for that, for a hiring process and academy each year. Our third goal, continue to promote a culture that values diversity within the organization. And I want to take a moment and talk very specifically on this goal, is that this goal and these recommendations did not actually come from our consultant. We have an internal committee here within the organization that has been very much employee driven, brought together by Local 106, and that committee is the one that really went out, did the research, and brought back these recommendations to the organization, and then were included in our overall plan. So I just want to point out the hard work of those folks internally that really took this one on and worked with it here. Our recommendations in that include implementing an annual training program on diversity issues, a recommendation to support the delivery of impactful and appropriate services to the community, and a recommendation to develop a robust recruitment strategy to encourage qualified applicants of all backgrounds. And as we look through those, we've got a lot of work left to do here. I've been in front of council a couple of times now talking about our hiring practices, and we have done well on moving the needle in our hiring practices to capture more diverse candidates, but we still need to work more on focusing on how we make sure we have inclusion and equity within the organization, and also how we recruit more people into the program. While our hiring process has done a good job of breaking down barriers in the hiring steps, we have not been able to actually go out and actively trying to recruit more. And so that's definitely one of the recommendations there. And then the support of the delivery impactful and appropriate service to the community. Again, just as we talked about the importance of equity and inclusion training for how we work within our department, within our coworkers. We also are behind on making sure that we have the appropriate training for our folks, looking at biases, cultural diversity, and mental health preparedness and training for those services we provide to the community. Our fourth goal here, improve the EMS response and support system. This is probably the biggest dollar item in this plan, and probably one of the biggest issues for daily services that we have right now is that the recommendation of supporting 2 dedicated BLS ambulances. I think most of the council is aware that we've talked a little bit about dedicated BLS cars in the past. Right now, all of our BLS transports are being done by our fire companies that are cross-staffing an ambulance and an engine. And every time they take a patient from their first due area to the hospital, that leaves that first due area without any fire or emergency coverage for high priority EMS calls. A second recommendation here is to implement an embedded peak time nurse into the communications center. The thought there with the looking at either an embedded nurse or even a nurse hotline type system is see if we can divert some of the calls off the system by being able to have a nurse that can interact and do some telehealth and other things to help people avoid needing the EMS system. And then third recommendation there was to increase the support staff for the second community paramedic. And that was actually completed in 2020 as part of EMS levy improvements. We have added actually a second and third community paramedic throughout the county. 2 of them here that work out of Bellingham Fire Department, and then a third one that's working out of Fire District 7. All 3 of them, and it's actually 3 teams, I should point that out. It's 3 teams of paramedic and social worker working together, and the 3 of them have split up the county and are working together as a team throughout the entirety of the county. And that all being funded right now through the paramedic side of it is all being funded through the EMS levy. Fifth goal, continue the improvements to the emergency services response system. We need to monitor the incremental improvements to the EMS system. We need to monitor growth in our northern sections, and particularly that urban growth area in Fire District 8 for increased population and commercial development. And we need to monitor increase to call volumes for the addition of resources. And these are probably the most long-term goals that are in this plan. You know, as you look through the plan, you'll notice that a lot of the goals indicated a 1 to 2 year time frame to get these projects up and running. And I think that's it says a lot about how far behind the department was or is. And this goal in particular is to make sure that we continue to be forward looking so that we don't continue to degrade services as we progress and we see increases in our community. Goal number 6, improve the capability of the life safety division. Again, here the recommendations were that we add a fire inspector, and as part of that, they also recommend that we establish a recruitment and selection process for fire inspector. This is one where we currently have 3 fire inspectors and a division chief or fire marshal. big part of a life safety's job is permit review for new construction. And of course, if you look around our city, we're seeing a lot of new construction out there and a lot of more complicated new construction as we get into these larger mid-rise type buildings and multi-occupancy type buildings. That has created a situation where the majority of our workforce in the life safety division has been focusing on permitting and inspections of that new construction piece, and it's not left a lot of time for them to deal with the ongoing operational inspections and ongoing enforcement of existing facilities. Goal number 7 there, partner with Fire District 4 to enhance the training facility. First recommendation to create a partnership with Fire District 4, and last meeting, council approved an interlocal agreement with Fire District 4 for the use of their training facility. That was one of the steps we're taking in furtherance of this goal. Recommendation to create a regional training consortium, and we have been talking with South Whatcom Fire Authority and Fire District 4, Fire District 21 for some time now on collaborating on training. In fact, we've been doing a lot of informal collaboration. If you've seen any of our posts on Facebook here lately of some of the big training that we've been doing at the old St. Luke's facility, those were all cooperative trainings that we were able to integrate resources from multiple departments in. So we're working on that. We're still quite a ways out from a fully integrated training consortium. And then the third recommendation here, support the expansion of that training facility. And again, training facilities has become even more of a problem here with the pandemic. While the training facility at Britton Loop that's owned by Fire District 4 is good for a lot of our daily training, we have historically used a facility run up in Maple Ridge, BC for a lot of our live fire training for academies and officer training. And because of the closure of the border, we haven't had access to that facility. And so it's been problematic for us, and expanding the facility out on Britton Loop would help with our needs to have to send crews out of town for those more advanced classes. Goal number 8, improve the health and wellness programs for emergency services employees. Again, recommendations here, work with other emergency services agencies, develop a regional approach, and review programs available specifically for emergency services personnel. So earlier, again, this year, we went through a process and we've got a contract with a vendor out of California that's been doing a health and wellness pilot program involving 12 employees here at the city, 6 police officers, 6 employees here at the fire department, and a program that looks at their physical and mental well-being. It's looking at nutrition, looking at exercise, looking at a lot of, again, more of the mental wellness program, stress reduction and that. So we are working on that right now, this pilot program with us and PD, and we're looking forward to seeing what that may translate to in future programs for employees. Goal number 9, enrich the capabilities of the communications center. And this was a push to start with, was to look at the daily supervision within the center. And recommendation was to establish a lead dispatcher position for each shift, and then promote the people into those positions. Through a collective bargaining agreement that we did in 2019, we were able to work with Local 114F, which represents the fire dispatchers, and come up with a program to where now each shift has a lead dispatcher on duty in the dispatch center. So we've completed this portion, or this set of goals. And goal number 10, enhance the capabilities of the emergency management function in the city. Recommendation was to establish emergency management planner position. We did that as part, again, of that mid-biennium adjustments between 19 and 20, and then recommend that we hire, promote an individual into that position. That was originally completed in February of 2020. The position is vacant at the moment, just because the departure of our former emergency manager, the person in the emergency management planning position moved up into the emergency manager spot. But we are working on getting that position refilled. So this goal, again, we feel like we've completed what the plan was looking for in this goal. So that is a lot of information in a short period of time. And there's, I think, an additional 179 pages of stuff in the packet there that outlines a lot of the background of where these different goals came from, but be happy to entertain any questions here.
Councilmember Knudsen.
Thank you, Chief Hewitt. I have to say that's one of the most detailed plans I've ever seen by any department here in the city. So I just applaud you and your staff and everybody that was involved in this. It's very detailed. I've read almost every page, and a lot of information in there that I didn't even know. So I think it's, I know it's long coming and we asked for it, but thank God you got it done, and it's a good report, and I want to thank you for that.
Other committee members or council members? Okay, Councilmember Lillquist.
Actually, I think Lisa was ahead of me.
Sorry about that. Councilmember Anderson.
Thank you. And thank you, Chief Hewitt, for the very extensive plan. It was very interesting to read through a lot of the statistical information. I did have a couple of questions. Well, one, is this going to be presented to the whole council later, just so I have an idea, or is this the one time it's being presented?
This is the start of presenting to the council. I guess I'd look for direction if the county or if the council would like more an additional opportunity to talk more about it. We'd be happy to do that. But I know that we will be talking about as we talk about budget stuff in the future. Our hope is to be talking about how budget requests tie back into our strategic plan.
Councilmember Lillquist.
I have a couple items, and I'm able to handle them now. Let me just take two, one really short. With regard to the Health and Wellness Initiative, I'm on the board of Whatcom Transportation Authority, and one of the things that they recently tried and has been very successful is an on-site physical therapist at the center, because a lot of the employees have minor rehabilitation needs, and the ability to not have to leave work or take a day off, but to have an hour drop by facility. So I don't know if there's rehabilitation needs for the fire and police service that would justify, a small on-site physical therapy facility, but Chief Hewitt, if you know, and if Chief Simon knows, that might be one way of improving the health of our public safety employees, and also do so efficiently. That was just a comment. With regard to diversity, are there incentives or rewards or some kind of performance criteria? So the City Council and some members of the administration recently took a diversity, equity, inclusion workshop. And one of the things that was highlighted is to get real progress in diversity, equity, and inclusion, you need to build it into your work plan and also, like set goals and also reward employees and supervisors for achieving those goals. Don't just say we'd like to, but actually kind of make it part of the work plan, make it part of the reward and hiring and promotion of people who are effective at advancing those goals. Have you considered ways of embedding those diversity goals into the incentives and the rewards for your leadership team?
Well, that's it's an interesting question because, of course, we don't, in public service, of course, we don't do a lot of incentives or rewards directly for individual employees. In the civil service and collective bargaining environment that we're in, that hasn't been a big part of what we're doing. I will say, just in general, in the diversity and inclusion piece, we have a lot of work that we need to do. We have, as an organization, again, we've very much the last 4 years, we very much have focused just strictly on the hiring piece, breaking down barriers to get people in the door. We have done very little work on what it looks like once you get in the door, or how do we get people to come to the door. Those are the two pieces that we are very much behind on, and again, that's one of the things that I'm very proud of in this plan, is that our employee group recognize the importance of those, and we're able to put those in, and I would suspect that you'll be hearing again more from me at budget time on how we start to implement some of that here in the organization.
Okay, it's very reassuring to hear that you recognize the shortfall and the work to be done. That's really encouraging.
I'm going to follow up with a question related to what Councilmember Lillquist just was asking about on the employee-driven EDI work. Does that group use a formal structure, like a task force for the county that adopted a racial equity toolkit? I'm just wondering if that's something that group uses or something similar.
The group, I wouldn't be able to tell you exactly how they got there, Councilmember Hamill. They, because it was very much a group that was put together by the local, through the local, and it has been somewhat hands-off from the administration, with the exception of us promoting that grassroots work going on there. I do know that they did engage a local, for lack of a better term, consultant in helping to develop those plans or develop those goals, I should say. And again, the next thing that we really need to do is more formalize that and bring it into the department and start to look at how do we fund some of the initiatives that go along with that.
Okay. Committee members, any other questions or comments? Council members, any other questions or comments? Councilmember Anderson.
Actually, Councilmember Huffman had her hand up first, and if you don't mind.
Yeah, sure. I just saw that. Sorry about that, Councilmember Huffman. Go ahead.
Thanks, Councilmember Hamill. So I thought that the suggestion to have an embedded nurse in the dispatch center was a really interesting one. Is there a sense of how many calls could be diverted with an on-site nurse, and would that be a contracted position where we're contracting with a partner, or what's the process, I guess, for seeing that happen?
There's a couple of things that we've been working on, and some of the things that kind of lead up to that. First one is we've been working with through our emergency medical dispatch, the program that we use, a program called ProQA. We've been working with our vendor on that to work towards becoming an accredited dispatch center. And that's one of the steps that we need to accomplish before we're able to use that nurse hotline as a call diversion. So in fact, the steps of identifying lead dispatchers, that was one of the small incremental steps in working towards that accreditation so that we can move towards this goal. The reality of it is, I will say, the recommendation from the consultant was that we would hire our own nurse and embed them in the center. Since that time, we've been talking with other agencies and looking at what's the reality of, if we hire one nurse and embed them in the center, that's going to give us somebody who works 40 hours a week and 40 hours of coverage. And of course, we are a 24/7 operation. And so trying to look at what the value of that embedded nurse is versus creating a contract with a third party that has an existing telehealth or nurse hotline type program, that we be able to use more, again, greater coverage, but maybe less of a direct employee cost and or make our money go farther, bang for the buck there. So we're still reviewing what that looks like. And I don't have, at the moment, I don't have any estimates on exactly what that would do to the call volume.
I want to speak to the accreditation process. It's come up twice now, once during the unarmed response meetings that are separate from council meetings. There's another group of about maybe it's like 20 people that are EMS, police, a couple council members, and one myself from city, and I think Councilmember Buchanan sits on that committee as well. But that accreditation for Prospect, which is our fire call center, is important. And when we're talking about an unarmed response, Chief McDermott mentioned that there's a accreditation process that they want to hold onto that because it's important for fire. And also in the previous presentation by Chief Rickman, there was a accreditation from BTC that was about $26,000. And so I want to make sure that I understand the importance and value of those accreditation processes and why they keep coming up in these discussions. And so I'm not saying that in a negative way at all. I just want to make sure that I, as a council member and the public, understands that there's a standard that fire. We have an excellent fire department, and there are standards there that the department, the organization meets. So I'm wondering, Chief, if you can just briefly speak to that.
Yeah, and very specifically when we're talking about emergency medical dispatching. So we have chosen the program that we've chosen, this ProQA program. We chose that. Gosh, I think we've been with them now for close to 20 years, and we chose them very specifically because of the studied path that they've done to create and review the questions that we ask, and the order that we ask them, and the timing that we ask them, to help provide for the best outcomes for the patient, as well as sending the most appropriate resources. And the program in particular that we've done is a very legally defensible program because of the research and development that they've done for years. And for us, when we start talking about doing things that are off script from that program, like diverting to a nurse hotline and that, ProQA has said, okay, you're able to do that as long as you meet this level of competency. And that level of competency is basically how we show that level of competency is to achieve and maintain accreditation. And so to to achieve and maintain accreditation, it's making sure that we're doing quality assurance on a certain number or certain percentage of calls all the time, that we're answering the phone within a certain amount of time, that our dispatchers are sticking to the questions on the script and following them correctly. So that's where, I mean, professional accreditation, and there's professional accreditation in almost every profession, right? It usually identifies that there's a standard out there and you are achieving it. In particular, as we talk about the dispatch one, is for us to stay legally sound with our emergency medical dispatch procedures, we need to reach that level of accreditation before we start looking at things like diverting to the nurse hotline. I will, just since you brought it up too, I will bring up, so we had a representative from ProQA was up here last week for a couple of days, and spent 2 full days with Chief McDermott, our division chief of communications, and we had a very pointed conversation with him too, that they need to get ahead of the game on unarmed response. And because I know we've talked about that a lot, and how that a co-responder type model works within the 2 dispatch centers. And that was one of the things that again, friends in the in other communities, fire chiefs in other communities that are looking at the exact same thing, very much know that we are working hard with ProQA to try and get them to identify how we can better triage for the future and what the real future looks like for us.
Thanks, Chief.
Yeah.
Councilmember Anderson.
Thank you. I do have a couple of questions, and it's in regards to the consulting group. They're page 3, but page 279 in our packet. It's kind of the first time I think I've seen, at least in writing, basically Fire District 8. It says the use of force over time as a result of increased vacation benefit, increased use of sick injury leave, and the staffing requirements of Fire District 8 arrangements. The Fire District 8 contract and memorandum of understanding requires that the fire department to provide 2 career officers and 2 career firefighters daily. The fire department is 7 personnel short to meet this requirement. Additionally, volunteer personnel are to make up the balance of the staffing of the 2 district stations. A lack of volunteer staffing also caused a need for force of overtime. Overall, repairing these 2 issues will help alleviate the overload dilemma. I know that in our contract for 2021, I believe we're getting something like 1.7 million from the county in order to operate Fire District 8. In the survey of personnel, the forced overtime really was an issue for well-being, mental health, family, those type of impacts. I know that we're working hard trying to increase volunteers, but that is kind of a national issue, let alone state, let alone county. It is harder and harder in the last 20 years to recruit volunteer firefighters for the fire departments. So it doesn't seem that that is going to be a really reliable staffing. So when there's not enough firefighter personnel, then we, I assume, need to take our full-time personnel from other stations, which then requires forced overtime. And I can send council the number breakdown that what this looks like it costs us, but it could potentially be short about $800,000 a year, which is what we're supplementing. And in the last year or 2, we have had to amend our budget in order to take care of staffing costs with the fire department at substantial amounts. So I'm wondering, one, what is the fix for this realistically? And if there's consideration of really taking a look at the cost and impact to make sure our upcoming contract with the county for Fire District 8 is representative of the true costs that are coming from the city. I don't mind, realistically us working with District 8 and providing that leadership and service. I just don't want to continue to augment the cost, the true cost of staffing that, to basically continue forced overtime in order to provide that solution. And two, it's not our fiscal responsibility as a city to supplement that cost. In fact, I think it behooves us as a city to seriously look at it and seriously have the contract represent that in what we get paid. Because as we look at needing, we have positions not filled across the city. And we went through a budget cycle that we had to cut things that matter to us. And I don't think we should be supplementing the county in order to provide these services. So I'd like to hear a little bit more. Again, I think this is the first time I've seen in writing that forced overtime is being connected to Fire District 8. So if you could speak to that a little bit. And again, I can send the number breakdown that I have to everyone. I just didn't send it in advance in order to support that claim of how much money it looks like we are supporting. And then I'll have one more question about the dedicated basic life support after this.
So we are over time. We've got our next committee has a 25-minute presentation, and we're about 12 minutes or 13 minutes over time. I'm going to ask that we bring this item back for discussion. This is a huge topic. And I don't want to rush the answer for Councilmember Anderson's important questions. So and I'm being prompted by my supervisor, my boss, to move along, and I'm going to do that now. So I'm going to end the committee, but Councilmember Anderson, I do want to recognize that's a big it's a big question. It's an important question. I wanted provided the appropriate amount of time for a good response. So I'm going to go ahead and end the committee and turn it back over to Council President Stone. Councilmember Vargas?
Yeah, if I may make a quick suggestion. This is a huge report. We've been waiting for it for 3 years, and I feel as though this should have been a committee of the whole discussion. And I'm wondering if for follow-up, we could actually move this to the committee of the whole for discussion.
Okay, I think that's a good idea. Councilmember Anderson brought that up before you got on the call here today, and I think that the whole council needs to be able to hear this and digest this and ask the questions. So I'm gonna ask the council president to make this an agenda item for council of the whole at a future council meeting. Maybe perhaps not the next one, but maybe the one after that. I'd like to return the conversation back to this as soon as we can. Does that please the council? So get head nods. Okay, great. Okay, I'll go ahead and turn it over to Council President Stone.
Thank you, Councilmember Hamel, and thank you, council members. I regret that today's agenda is extremely packed, but I would like to see this discussion come back before the committee of the whole as suggested. So we will schedule that accordingly. Our next committee this afternoon is Climate Action, which is chaired by Councilmember Vargas.